A cruise ship departs Argentina. Within weeks, passengers are being airlifted to ICUs across multiple continents. 3 people are dead. A virus with a fatality rate between 30 and 40% is now under international monitoring. That virus is Hantavirus, and while health officials are working quickly to contain it, there are things your doctor wants you to understand about this disease. Things that go far beyond the headlines. In the next 12 minutes, we're going to break down exactly what Hantavirus is, how it spreads, what symptoms to watch for, who's most at risk, and most importantly, what you can do to protect yourself and your family. Hantavirus is not a new virus. It's been known to medicine for decades. But what makes it particularly dangerous is how it behaves once it enters the human body. Hantaviruses are a family of viruses. There are more than 50 known types, and they all share one thing in common. They live in rodents. Rats, mice, and other small rodents carry these viruses without getting sick themselves. The danger begins when humans come into contact with those rodents, or more specifically, with what those rodents leave behind: their urine, droppings, and saliva. Here's the part most people don't realize. You don't have to touch a rodent to get infected. In many cases, the virus becomes airborne when contaminated dust from dried rodent droppings is disturbed. That means simply sweeping out an old shed or cabin without proper protection can put you at risk. This is a virus that is silent, invisible, and already present in the environment in many parts of the world, including parts of North and South America, Europe, and Asia. When medical professionals talk about hantavirus disease, they're typically referring to one of 2 clinical syndromes. The first is hantavirus pulmonary syndrome, or HPS. This is the form most common in the Americas, and it is the one currently making news. HPS attacks the lungs. It starts with flu-like symptoms that can rapidly escalate into severe respiratory failure. This is the form with the highest fatality rate. Nearly 4 in 10 people who develop respiratory symptoms from hantavirus may die from the disease, according to the CDC. The second is hemorrhagic fever with renal syndrome, or HFRS. This form is more common in Asia and Europe, and it primarily targets the kidneys. Symptoms include intense headaches, back pain, fever, chills, nausea, and in severe cases, internal bleeding and kidney failure. Both forms are serious, but it is HPS, specifically the Andes strain of hantavirus, that is currently under international monitoring. Let's address the biggest misconception people have about hantavirus right now. Most strains of hantavirus cannot spread from person to person. This is critically important. The hantaviruses found across most of North America, the ones transmitted by deer mice, are not known to transmit between humans. This is why, historically, hantavirus has not caused widespread epidemics. However, and this is where the current situation is different, the Andes virus, found in South America, is the only known strain of hantavirus that can spread between humans. Even then, transmission requires close, sustained contact. Think sharing a bed, caring for an ill person, or prolonged exposure to respiratory secretions. This is exactly why the outbreak aboard the MV Hondius cruise ship became so alarming. Passengers were in close quarters for weeks. The Andes virus appears to have spread between people in that confined environment. The WHO has been clear. As of now, the global public health risk remains low. There is no evidence of widespread community transmission. This is not behaving like COVID-19, but it is being monitored closely by health authorities in over a dozen countries, because with Andes virus, human-to-human spread, though rare, is medically possible. This is one of the most clinically important parts of this conversation, because early recognition of hantavirus symptoms can be the difference between recovery and death. The disease typically unfolds in 2 stages. Stage 1, the early phase, lasting 3 to 7 days. During this phase, hantavirus mimics a bad flu. Patients experience fatigue and extreme tiredness, high fever, deep muscle aches, particularly in the thighs, hips, back, and shoulders, headaches, dizziness. In some cases, nausea, vomiting, diarrhea, and abdominal pain. This is the stage where people most often dismiss their symptoms. They assume it's just a flu or a stomach bug. But if you have been in an area with rodent activity, a cabin, a garage, a rural area, and you develop these symptoms, you need to tell your doctor immediately. Stage 2, the cardiopulmonary phase, typically days 4 to 10. This is where hantavirus becomes life-threatening. Patients begin to experience a cough, often dry and non-productive at first, shortness of breath that worsens rapidly, fluid accumulating in the lungs, a drop in blood pressure, heart irregularities. In severe cases, respiratory collapse. The window between stage 1 and stage 2 can be extremely short. Once stage 2 begins, the disease can escalate to critical condition within hours. This is why early medical intervention is so vital. If you or someone you know has been around rodents and develops these flu-like symptoms, do not wait. Seek medical care immediately, and specifically mention possible rodent exposure. Hantavirus does not discriminate by age or underlying health condition the way some viruses do. Even healthy, physically active people have died from it. That said, certain groups carry the highest exposure risk. People who work in or around rural or forested areas, farmers, construction workers, hikers, campers, people who enter long unused spaces, cabins, storage units, barns, attics, basements with possible rodent infestations. Travelers to endemic regions, particularly rural Argentina, Chile, Bolivia, Brazil, and parts of Europe and Asia. People with high rodent exposure at home, especially in areas where deer, mice, or other hantavirus-carrying rodents are common. In the current cruise ship outbreak, the index case, the first person believed to have contracted the virus, had traveled through rural South America on a bird-watching trip before boarding the ship. Health investigators believe exposure may have occurred near a location frequented by rodents. This is a reminder that exposure often happens in settings that feel safe and even scenic. A nature hike, a bird-watching excursion, a countryside road trip. The risk is real, even in beautiful remote environments. If you believe you may have been exposed to hantavirus, here is what medical guidance recommends. Step 1. Do not wait for symptoms to worsen. Seek medical evaluation early. Inform your healthcare provider of your potential exposure before your visit if possible, so they can take appropriate precautions. Step 2. Be specific with your doctor. Tell them exactly where you were, when you were there, and what kind of rodent contact or environmental exposure you had. This information directly influences how quickly a physician considers hantavirus as a diagnosis. Step 3. Understand that there is no specific cure. Currently, there is no approved antiviral treatment for hantavirus pulmonary syndrome and no licensed vaccine. Treatment is supportive, meaning medical teams work to stabilize your breathing, blood pressure, and organ function while your immune system fights the virus. ICU care, oxygen therapy, and mechanical ventilation are used in severe cases. Step 4. Early care dramatically improves outcomes. Patients who receive intensive care early, before full respiratory distress sets in, have significantly better outcomes than those who wait. This point cannot be overstated. The comparison to COVID-19 is understandable. A new virus, international news coverage, cases emerging in multiple countries simultaneously. But infectious disease experts are drawing clear distinctions, and they are cautiously reassuring. Unlike SARS-CoV-2, Hantavirus is not a novel pathogen. It has been studied for decades. We understand how it behaves. We know its primary transmission route, rodents to humans. And we know that even the Andes strain, the only human-to-human transmissible variant, requires close, sustained contact for that transmission to occur. The WHO Director General himself described the current situation as a serious incident while emphasizing that the global risk remains low. Officials have stated clearly that they do not anticipate a large epidemic. What they are focused on is thorough contact tracing, isolation of confirmed cases, monitoring of close contacts, and getting diagnostic testing capacity to countries that need it. This is not a situation that warrants panic. It is a situation that warrants awareness. The good news about hantavirus prevention is this: the primary exposure route is well understood, and practical steps you can take at home significantly reduce your risk. Seal your home. Mice and rats can enter through gaps as small as a dime. Inspect and seal any cracks or openings in your walls, foundation, and around pipes. Steel, wool, and caulk are effective for this. Control rodent populations. Use traps if you have signs of rodent activity. Avoid using poisons unless necessary, as dead rodents can still carry virus in their remains. Clean carefully. If you find evidence of rodent activity, droppings, nesting materials, do not sweep or vacuum. This disturbs the material and can aerosolize the virus. Instead, wear gloves and an N95 mask. Wet the area with a bleach solution and wipe it up with paper towels. Place everything in sealed plastic bags for disposal. Ventilate before entering. Before entering a cabin, storage building, or any space that has been closed for an extended period. Open windows and doors and let it air out for at least 30 minutes before going inside. If you travel to endemic areas, be aware of your surroundings. Avoid handling wild rodents. Sleep in enclosed, protected areas when possible. If you develop flu-like symptoms within 6 weeks of potential exposure, mention it to your doctor. Hantavirus is not a reason to panic, but it is a reason to be informed. The science is clear. The risks are manageable with the right knowledge. And the most dangerous thing you can do is ignore early warning signs. If you found this breakdown useful, consider sharing it with someone who spends time outdoors, travels to rural areas, or might benefit from knowing these facts. Drop your questions in the comments and subscribe for more health content that goes beyond the headlines and focuses on what actually matters for your well-being.